Check your posture with pictures. We know that there are consequences to poor posture. Most of us, when we think of the word posture, you're thinking of it from the side, right? And that is the most important, and we should be thinking about this and so forth. There are consequences. I've talked about this in prior shows. You literally lose years off your life. This has been calculated and demonstrated. You also lose quality of life, and you have more organ dysfunction potentials with this posture than this posture, especially when you get older. So there are consequences. We're also going to talk about the front to back posture. If someone's posture is like this, there's a consequence to that, okay? And if we're able to take action, say with chiropractic and some other things, better case scenario, particularly when it's caught early. So we can do that with pictures. Also, when your posture is like this from the side especially, you're going to accelerate degenerative disc disease, degenerative joint disease, arthritis, breakdown of the spine, and so forth, okay? So there's more long-term pain consequences with bad posture. That's why it's so important to take care of posture, know about it, talk about it, and with so many of my patients that come in for chiropractic visits, we talk about posture all the time, just as a reminder. Every time, as I like to tell my patients, every time I talk about it with you, it's helping me, I'm helping you. We're helping all of us trying to maintain that posture. One of the big things we're trying to combat with posture is text neck, right? So a few of us might have these, right? A few of us. You occasionally might see someone like this. And I've talked about this in prior shows. If the head is 10 pounds, you go 20 degrees forward, it's 20 pounds, and 30 degrees is 30 pounds, and 40 and 50. When you go 60 degrees like this, it's like 40, 45, 50 pounds more relative pressure, stress, and work on all of the tissues back here by just doing this. So as a little hint, let's start getting the phones up in here when we can and using them like this as best we can. Text neck. We've gone over the statistics. The average teenager is on their phone something like 12 to 13 hours a day. That'd be like if I handed you a dumbbell, a 10-pound dumbbell, and say, hold it here, don't hold it here for 12 hours. My goodness, the stress on the wrist and the elbow and the shoulder and the neck would be tremendous. Now, if you hold it in the center of the teeter-totter in shot put position, you can do that much better, much longer, with much less stress. Same with the head. We need to get the head back into alignment here to take the stress off in the center of the teeter-totter. The same thing from front to back, and we can work on those aspects as well. If someone looks like this, and that is a changeable situation, let's say not a difficult adult scoliosis, let's say we can change somebody like this and we can bring them a little bit closer to normal. Think of, again, the lateral stress that's on there. And some of my patients with scoliosis, when they're bent over here like this, actually, oftentimes the concave side, see, I'm just demonstrating in the lower back here now, right now, the concave side is under more compression and pressure. So we get more disc problems, herniations, bulges, and so forth, and pain, and oftentimes even leg consequences on that side as well. It can happen on the other side, but nudging that in the right direction by knowing where we are is a good thing. You can have professional posture pictures taken with analysis in my office and many other chiropractic offices, and probably some physical therapists are doing that too. But in lieu of that, let's talk about what you can do at home. So you can take your little device if you happen to have one of these, and if you're talking about your kids, or your spouse, or your parents, you can catch them off guard. So if you see one of your children studying, or they're on their phone, and you can snap a picture of them while they're really like this, I mean, that's a good idea. And then show them later and see what's going on. Or maybe somebody will catch you when you're doing something like cooking on the countertop or stove, or reading, or on your computer, so we can be aware of this. When my mother was alive, I was concerned about her posture, and I was trying to help nudge her with better posture. So she agreed to have some posture pictures taken, which I did. And sure enough, she was very much like this, and I showed her the picture. She had no idea because she couldn't have the concept. But when I showed her the picture, she was like, wow, that's terrible. And then we took some action to make some correction. That's what we're getting at here. So catch other people when they're not watching, when they're not conscious of it, and maybe somebody catches you, and you can use that as a reference point, as a motivator. Look at that picture, and I do this all the time with patients in my office. Now, then you can take a more updated picture of where you are now. Take some from the side and take some from the front. Now, again, if you're not going to have one professionally done in my office, you can do it on your own. And what I recommend is find a blank wall at home and use the same wall if you're going to do a repeat picture down the road. And here's what you do. You're standing on your side. As long as you don't have any dizziness problems and you're not going to fall like this, what you do is you close your eyes, you bend your head back and then forward, maybe do that a couple of times, and then I want you to feel where you are, where you normally are. Not trying to correct yourself, but you just go into your normal posture. So I'm going to do it right now, and you can see that this is my set point. Okay? Not bad. It's pretty good. So you can have somebody else snap your picture. That's your reference point. That's where you are now. The second thing you can do is, from the side, then do a corrected posture. Remember that exercise I talked about, the tall wall? So you lean against the wall, you touch your heels, your rear end, your shoulder blades, and the back of your head, almost like a military posture or a dancer's posture, right? Now you do a dancer's posture. You pull yourself up as tall as you can, have somebody snap a second picture. Okay? This is what I do with my patients, and I have a nice grid so we can really see what's going on. But you can use the wall. So you pull up tall like this. So I'll take two pictures of patients from the side, and then I'll have them take pictures of me, and I'll show them where I am normally. I'll show them corrected, okay? And they can see where they are, how much they can correct at that moment in time. Then we take pictures from front to back. Same thing, as long as you don't have any problems with having your eyes closed. You can stand with your feet apart, and you nod your head a couple of times like this, bring it back to where you feel as though center is. And again, not correcting or straightening yourself, just normal, natural. Have somebody take a picture, okay? And then there you go. From front to back, it's very much more difficult to know what to correct. Unless somebody shows you the picture and your head's over here, and then you take action and have them snap another picture and do that. But mainly what I'm talking about is from the side, From front to back matters. I had a teenager come to see me recently with some spinal pain, and mom was there as well. And I'm looking at her, and I always analyze posture visually, not just with pictures, but visually. And I could see that she had a consistent head tilt. So I took a picture of her. And then I said, pull up some other pictures on your phone that you have. I bet you're probably always like that. And they thought, I've never really noticed that. Mom said, gee, I always thought she was kind of like that because that's just when she's pondering something, she kind of has that posture. So we flipped through a handful of pictures, and sure enough, she's consistently like this. Then we had some x-rays taken. In her case, she needed x-rays. So we took some x-rays, and sure enough, we saw it over here like this. So with my chiropractic techniques and adjustments, we're going to be trying to improve that as best we can to bring that back into the gravitational line. Okay? So that's another thing that you can do. Once you take these posture pictures, then you can look at some previous pictures that you might have on your phone or somebody else has of you, and you can see if you have an established pattern. And then you can take actions. So what I recommend is go to my YouTube page if you haven't watched it here on the cable television show. Do some spine exercises for a month. Do some tall wall exercises for a month. Do some of the prone extension exercises for a month. Just increase your awareness. Maybe print one of those pictures, or at least have it on your phone. Maybe have a sign at work that says posture. Put in your computer or your phone every hour during that month. Every hour you're going to do one of the posture exercises, one of the ones that you've learned from me, whatever it might be. Do that for a month, and then repeat the posture pictures on your own. Go to that same piece of wall, have somebody take the picture again. You go into that neutral posture like this. Again, not corrected, just normal, natural. Snap a picture. And then compare that one with the one that you took a month before. This is something that we do in my office professionally. Again, we have a grid and we take pre-post posture pictures, but you can see the changes. Now, sometimes when people correct this, it corrects misalignments from front to back as well, so redo the one from front to back if that has a misalignment. Okay, so you do the same thing. You have your eyes closed. This is a month later, and then you bring yourself into center, not corrected, just normal, natural. Take another picture and compare that with the original, and then see where you are. That's how we do posture pictures, and that will help with some of the consequences. You want to make sure that you don't de-evolve, which I talk a lot about, and you've seen this poster before on this show. Let's take action now to make sure we're not heading in this direction, which a lot of us have the concept that this is normal. It's not, because we all know people in their 80s and 90s that are like this. Not everyone, but it can be done by taking action now. Try posture pictures. I'm Dr. Scott Fuller.